Good morning, everybody. I apologize if we're starting a few minutes late and appreciate our leadership team from the VA being here today, including our Deputy Secretary and our Acting Undersecretary and our Principal Deputy Undersecretary and our Deputy Undersecretary for Operations and our Chief Counsel. Later on this morning, the Inspector General is going to release a Inspector General report on the state of the Washington, D.C. VA. And I think that this is an important enough report that I wanted to have a chance to talk about it. And I want to start off by thanking the Inspector General for the work that they're doing, the comprehensiveness of this report, and the value of this report to helping us get this system right. Back when the IG was doing this work here at the Washington, D.C. VA in April of 2017, the Inspector General took an unusual step, at least from my experience, and he picked up the phone and he called me and he said that he was very concerned about some of the findings that the team who was here was finding in terms of concerns for veteran safety. Within a very short period of time, a matter of hours of getting informed by the Inspector General of that and confirming some of those findings, I took immediate action to relieve the medical center director at that time of his duties, and we asked Mr. Larry Connell, who's here off to my left, to assume the responsibilities of the acting medical center director at that time. Since that time, we have had numerous changes in the leadership here at the medical center, including the deputy director position, the assistant director position, and the nurse executive position. So this is largely a new leadership team. The chief of staff position had changed not too long before with the planned retirement of our longtime chief of staff earlier, a little bit earlier than that. Now, because of the concerns of Mr. Connell coming in place at that time, we stood up a incident command center and began to immediately start dealing with the problems that the Inspector General had identified. And you're going to be able to hear about the actions that, under Mr. Connell's leadership, that have happened here at the Washington, D.C. VA to make sure that this is an environment that is offering high quality and, most importantly, safe care to our veterans. We serve about 93,000 veterans in the greater Washington, D.C. area. We take that responsibility extremely seriously. Let me make clear that this report has identified unacceptable findings, completely of great concern to all of us in leadership. We've taken this report very seriously. You're going to hear that there are about 40 recommendations that the Inspector General has made. Mr. Connell, again, in a short period of time, is going to be addressing those recommendations. But I did, in particular, want to note two items that in the work that has been undertaken here at Washington since we were identified about the issues in this report in April that have indicated to me significant improvement in the environment here. First, and Mr. Connell will talk about many other issues that we have corrected, but at the time of the report, there were more than 9,000 outstanding consults in our prosthetics department here at the Washington, D.C. VA of greater than 30 days. That's just completely unacceptable. Today, the number of outstanding consults greater than 30 days would be 0. So that's a big difference for our veterans who are seeking care in prosthetics and orthotics from the Washington, D.C. VA. The second issue that makes a big difference to me that I focus on is what our veterans are saying about their experience here. Since April of 2017, we've seen a 26% increase in the number of veterans who would recommend this hospital to their peers and their families since the change of Mr. Connell coming on board and a new leadership team being put in place. A 26% improvement on a standard federal survey called the HCAP survey is a big deal to see that type of change. So I believe that we are headed in the right direction. But before, again, I turn this over to Mr. Connell, let me just tell you that I've spent a lot of time with this report. This, to me, represents a failure of the VA system at every level. A failure at the facility level, a failure at the network, or what we call the VISN level, and a failure at the central office, what we call VACO. This has demonstrated to me just unacceptable system failures, not single causes, but that we have to begin to address. Fortunately, and let's make this clear, there has been no identified patient harm. So these are system failures that we need and we must correct, but fortunately, this has not led to any known patient harm. When I became secretary, I said I was going to look at VA as a business, and the way that you look at things as a business is to identify risks and then begin to identify solutions, and that's exactly what I'm going to be doing today. As I've said, not to act when you identify system failures, I think, would be negligent. And so today, I'm going to be announcing the beginning of VA's restructuring efforts to begin to address these issues identified in this report. And not only this report, I believe that the issues that have happened here in Washington and these system failures are impacting other facilities across the country. It's why we see Inspector General reports that identify similar issues across many facilities, as well as reports by the General Accounting Office that have identified us as a high-risk organization and have identified these types of system failures. So I've directed that we begin to start doing changes at every level of our organization, at the facility, at the network level, and at the central office level. First, at the facility level, we're going to be implementing on-site, unannounced survey visits by an independent healthcare organization. These are going to be experts from the private sector who are going to be coming into VA hospitals to help our teams understand where there are opportunities to improve and to help us understand what the actual performance of the facilities are so that we do not have surprises in the conditions like we saw here back in April of 2017 at the Washington, D.C. VA. I've also instructed to begin immediate hiring and staffing reviews at every facility. I think you'll see in this report we had a 54% or 50-something percent vacancy rate in our logistics and supplies here at the DCVA. That is completely unacceptable, and we just can't have situations like that anywhere else in the country. So we will begin those reviews immediately with that information going directly up to our undersecretary. We have identified 15 organizations throughout the country, 15 facilities that we call low-performing facilities, where we are concerned about the performance. We have directed targeted efforts with specific action plans to make sure that these facilities are improving and moving in the right direction, like we are here at the Washington, D.C. VA, as you'll hear shortly. And demonstrated improvements are required for us to be able to stay on track with those low-performing facilities. And at each of our facilities, we're moving towards rapidly same-day services for our prosthetics work. Today, here in the Washington, D.C. VA, the average turnaround time is 2.4 days. We're moving not only here but across the country to a same-day services model because our veterans deserve that. At the network level, what we call our VISNs, I've asked that a special team be formed working with our National Leadership Council to redesign what the VISN looks like. The VISN model was put in place close to 20 years ago, a very innovative model that has served VA well. But like every business, the times change, the needs change, and it's time for us to look at how we operate our networks differently to get the type of accountability that's needed to make sure we don't see the failures that we saw here in the Washington, D.C. VA. Effective immediately, we're putting a new executive in charge. He is here with us today. Dr. Gamble, would you stand up? Dr. Brian Gamble, who has a distinguished career as a general officer in the United States military, running some of the most complex health organizations in our military health operations. He's been with the VA. He's now, up until today, has been down in Orlando as the Deputy Chief of Staff. Dr. Gamble is going to have direct accountability for 3 VISNs as we begin to redesign the role of the VISNs. These are VISN 1, which is the New England area, VISN 5, which is the Washington, D.C., Maryland, West Virginia area, and VISN 22, which includes Phoenix, as well as some of our other Arizona and California sites. Those facilities will report directly to Dr. Gamble, who will be here in Washington reporting to our leadership here in the Veterans Health Administration. And his responsibility is to oversee and to directly improve the accountability and performance, working with our facility directors to make sure that these facilities are performing up to the standards that we expect for our veterans. We will be announcing that Dr. Mayo Smith, who has been our VISN director in VISN 1, will be retiring. Miss Marie Weldon, our VISN director in VISN 22, at the end of the month will be retiring. And so what I've asked to do, what Dr. Gamble will be doing besides just making sure that these 3 VISNs are operating under the correct performance standards, is that a report be given to me by July 1st of this year with a plan to reorganize and to improve the function of our networks. We will do that with our National Leadership Council, who are network directors, as well as directly through the work being done by Dr. Gamble. At the central office level, again, where we have identified failures, I've asked for an immediate plan to restructure our procurement and logistics department. This is a department that every facility relies upon, where there has not been clear enough accountability. There has been duplication and overlap between what's happened at the facility, the network, and VACO, and we're going to be reorganizing that with a plan to be presented so that the structure is delayered and is functioning in a way that works better for direct results and accountability. I've also asked that we look at a new method of governance. When you look at failures in systems and failures in accountability, you can often trace it back to leadership and to governance, and we need to be looking at both. In terms of governance, we're going to be looking at working again with our National Leadership Council to establish governance, and this time working more directly with the private sector in terms of input into those best practices of governance around the country with some of our academic medical center partners who can help us do that and assure that we have the right models in place. In particular, we've been working with Johns Hopkins in a model that has shown very effective improvements in performance, particularly in safety, as they've been able to implement a new model. We've been working in some of our VISNs to test this, and we think it's a model that's worthwhile rolling out further into the country. I've asked that there be a plan presented to me for the central office reorganization by May 1st of this year. We're looking to make sure that the central office has greater accountability, that it is streamlined, that it is delayered, and that we can return resources from administrative functions back out to the field where they more directly impact veterans. So, as I mentioned, this is the start of a restructuring effort for the Department of Veteran Affairs. I think it's essential that this work begin now. And I'm going to turn this over to Mr. Connell to talk specifically about the changes and the impact of the report here at Washington, and then we'll be glad to open it up to any questions that may be in the audience.
Sir, thank you for your leadership during this time since April, and I want to thank the rest of the VHA leadership for their support to this medical center. I'd also like to take this opportunity to thank the IG for bringing to our attention the highlighted areas where we can and have improved care for our veterans at the DCVA Medical Center. I also want to thank the staff of the DCVA Medical Center who provide safe, quality care to our veterans and ensured there were no adverse outcomes. And I am very proud to work with a team of such dedicated professionals. This hospital is a different hospital today than it was back in April. Dr. Shulkin mentioned some of our improvements, and I'll go into a little bit more detail, but very quickly, in terms of critical leadership hires, the new leadership team is almost entirely in place as of today. We still have 2 more holes we need to fill, but the leadership team is almost entirely in place. Service chiefs, and there's a bunch of them, but I'll just list a couple important ones. We've hired a full-time deputy chief of staff permanently, a new police chief permanently, a new chief of surgery permanently, a new chief of logistics permanently. And I can go into detail later, but we are moving with hiring permanent positions here at the DCVA Medical Center. In additional hires, we're hiring additional mental health providers to increase access for health care at the Washington DCVA Medical Center. We've hired more than 50 nurses here. And an additional 50 support staff for people like answering the phones. One of the problems we have here is our phone service. We're hiring additional people to answer phones for our veterans. In terms of logistics, as Dr. Shulkin mentioned, we've hired additional logisticians as well. We're winding down the use of the off-site warehouse, which is across the street at the Armed Forces Retirement Home, and dispositioning the excess equipment over there in accordance with federal regulations. Our goal is to empty that warehouse by this summer and not use it anymore. Let me quickly address hospital cleanliness. When I got here in April, the facility didn't look like it does today. It's much cleaner today. I often get compliments from both veterans and employees on how clean the hospital looks today. Our latest patient satisfaction scores indicate very high satisfaction with the cleanliness of this facility. And a true story, somewhat humorous, is a veteran came up to me one day and said, "The bathrooms are now so clean that I actually feel guilty when I use them." That's how clean the facility is now. It didn't look like this in April. Dr. Shulkin talked about our success story in prosthetics, going from 9,000 prosthetics over 30 days to 0 today. We've also implemented a new governance structure here at the Washington DCVA Medical Center. So this year is going to be an exciting year. I'm very excited for fiscal year 18. Let me briefly talk about, as it relates to modernizing the VA, some of the big projects that are going on here. Our inpatient mental health ward is going to undergo renovation. Our 3 David East Wing, it's a very old inpatient mental health ward. It's going to undergo an entire renovation this year. Our emergency department, it's a small ED. It's only 11 beds. We need more. We have a plan moving forward to increase the size of that emergency department to 21 beds. In the meantime, we've got a bridge strategy to open up more space there and more nurses in there to better serve our veterans. That's happening now. Parking. I get lots of complaints on parking here. We're going to increase the size of our inpatient or our patient parking garage. We're going to add 2 stories to that. We're increasing additional parking spaces across the fence line out the back side of here. We're going to increase our patient parking to over 350 additional parking spaces here. That's happening now. Our community living center, complete renovation now. Our sterile processing downstairs in the basement, a brand new renovation that's happening right now. By the end of this year, we hope to have a brand new SPS unit downstairs in our basement. This year, we're going to open up a brand-new CBOC in Montgomery County. Sometime this summer, we're going to cut the ribbon on a brand-new CBOC. And lastly, where our veterans like to eat, down in our canteen, we call it, the cafeteria, that's undergoing a complete renovation right now. So I'm excited about these projects for this fiscal year to better serve our veterans. We're not standing still. We're moving out with making this facility even better than it is. Lastly, I'll just say this is a great hospital for veterans to receive their health care. I'm a veteran myself. I served 30 years in the United States Army, just retiring 2 years ago. I am so confident in the quality and safety of care at this facility that I am enrolled here to get my health care. In closing, I'd like to thank my fellow veterans who have chosen the Washington, D.C. VA Medical Center as their provider of choice. We will continue our efforts to earn and maintain their trust, and we will improve our processes in order to provide the best health care possible for our veterans. Again, I want to thank Dr. Shulkin for his leadership and the support of VHA Central Office.